Hey guys, today I'm going to be talking about one of my favorite skin boosters, the one and only the one that has been Korean FDA approved to be allowed to inject into the skin, but I'm sure it's different for every country. I don't know if it's been FDA approved in your country, but actually in Korea, it's the only skin booster that's been Korean FDA approved to be injected into the skin directly. So Rejuran, I don't know how to pronounce this in English. This is how we pronounce it in Korean. Was actually made here in Korea. So the components of Rejuran is actually from the sperm of salmon DNA. Why salmon then? Actually, apparently the salmon DNA is very, very similar looking to the human DNA. And so the components that is in Rejuran is actually a part of the particles of the salmon sperm DNA called polynucleotide, or you can call it PN. So that's the only component composed in Rejuran. But there are three types. One is Rejuran I. I don't know if this is actually exported to overseas, but in Korea, actually, we have three types. One is for the eyes, eye, and healer for the entire part of the skin, face, wherever you want to inject. And there's this one other type that I don't actually do at my clinic. It's Rejuran S, standing for scars. But they're actually all 100% polynucleotide. They don't differ in the component percentage, but the difference is actually the viscosity of the component. So for the eye, as an example, it would be more less thick compared to the healer, made specifically for the eye part, where it's actually thinner of the skin. And the needle that is actually inside is 34 gauge big, so it's smaller than the one that's actually inside the healer. So the eye comes in this kind of box, and there's only one syringe composed of 1 cc in this box. And the healer that I do a lot of, I'm gonna actually open this box. There are 2 syringes. One syringe, it's composed of 2 cc's, and it comes with 2 needles, 33 gauges. So this one box will be a total of 4 cc's and 2 syringes. Usually I use 1 syringe per person, and I do 3 to 5 treatments 2 weeks apart. So that would be like, what, 4 weeks in total until you finish 1 cycle. And if you finish 1 cycle, I tell my patients that you might want to repeat the entire cycle again after maybe 6 to 8 months. But it's such a painful procedure. Because you actually have to needle it, inject it right into the skin. So it's not like a non-painful procedure, but if the indication is right, the effect is just amazing. That's why a lot of people, I actually recommend doing Rejuran. If they actually fit into the indication, of course. These are all the syringes I've been collecting that I've done for the past maybe 2 to 3 weeks. If these 2 get filled, then I'm gonna have to throw them away and do the collection again. But this is how much I do of this Rejuran procedures at my clinic. And so what is the indication for this painful treatment? Actually, so the reason for Rejuran, so why are you injecting like salmon sperm DNA into the skin? It actually resurfaces and rejuvenates and regenerates the skin collagen that's placed in the dermis part of the skin. So to actually maximize the effect of Rejuran treatment, since it's painful, you might want to do it right when you do it, is the injecting actually has to be precisely done in the dermis part of the skin. But since you can't actually open up your skin and look at where you're injecting at, one guideline that I use personally is the embossing of the face. I'm gonna actually show you not a before and after, but what I'm referring to as embossing. The reason why you get this kind of physical appearance is because the particles of polynucleotide is actually big. So once you inject the particles into the dermis precisely, you're gonna feel some pain because the particle is so big going into the dermis, and the particle is what you see outside as the embossing. So that would be a very nice guideline to actually see if you got the procedure done precisely into the dermis to get a maximal effect of the procedure. And probably you might get bruising just a little bit, but usually I'm very delicate in doing the injections, try not to give bruises. But if you do, which is actually very possible because it's an injection, it will probably last for like 3 to 5 days, and the embossing will probably last 24 to 48 hours. It's not like a filler, so it won't stay, so don't be frightened that the embossing won't go away. It will, promise. And very, very effective for dry skins specifically. So usually when patients come in and does consultation with me before any procedure, they would probably tell me what their problem is. And if they name maybe, oh, I'm dehydrated all the time, my skin cracks up after I put makeup on, I look cracky, then the first procedure I actually recommend is this Rejuran. Many clinics here in Korea, they usually tend to do sedation because it's so painful, but I do not recommend sedation when doing specifically this Rejuran procedure, because in order to get the embossing to figure out whether the particles went into the dermis precisely, since it's such a delicate procedure, you tend to move a lot when you are sedated, and that means I won't be able to do the injection precisely or delicately as much as I would want to. So what I do is I use numbing cream, and usually that's just fine. No one actually ran out during the procedure, so it's something that you can actually undergo through. It's fine. But if you are maybe have a needle phobia or whatsoever and just can't do this, then maybe you might want to consider sedation, but it's not like a first option thing that I recommend. First of all, for your own safety. And probably if you get sedated for this procedure, that means your doctor is gonna have to do it very quickly because you're gonna be moving around a lot. That means that the doctor won't be able to put it precisely into the dermis part, meaning it'll have to go in deeper, maybe into the fat part of the skin, and that's gonna just lessen the effect of Rejuran procedure. And like I said, then maybe it wasn't worth it. I mean, it's such a painful procedure. Get it right when you do it. That's my saying. That's my thought. But the choice is yours. You can do sedation, numbing cream, without numbing cream whatsoever. I actually, even with the numbing cream, I sometimes recommend eating like a painkiller before the procedure, and that tends to help the patients loosen up a bit. But anyway, so the Rejuran is specifically very, very effective for hydration of the skin and resurfacing, maybe like acne scars and such. But for acne scars, you might need maybe more than 4 to 5 treatments. Compared to hydration of the skin, you might, feel the effect even after the first one. But, the resurfacing, regenerating, and rejuvenating of the skin, speed, maintenance, it's all different for every patient. So this as well, you need to consult your doctor before you actually choose to do it. And this one misconception that some people have of Rejuran is that I actually read this in one of the comments, not on my channel, but someone else's. But Rejuran does not cause blindness like like fillers. They're totally different components. This, even if it goes right into your artery or wherever, it's gonna be fine. So that kind of side effects you don't have to worry about. Very, very safe. The only side effects that you might want to consider are bruises, or maybe a pain, and maybe a bit of a swelling. That's about it. So no blindness, it's not a filler, so it's not gonna volume up your face or wherever. So no need to worry about that. Oh, and actually, I've tried Rejuran treatments on the neck as well before I do like actual filler treatments for, like the lines, horizontal lines. I use Rejuran Eye because because the neck is actually very delicate, like the eyes. So this was actually very helpful. It doesn't get rid of the lines, obviously. But before doing the filler procedure, I used the eye like a week before in advance, and it did actually help a lot in rejuvenating. So it might be an option if you are very considerate of your neck. So that would be one of the options that you might want to consider. So Rejuran, obviously very good for all skin types. Wherever you want to inject, it's fine. But usually in Korea, like I said, very focused on the face. So all these I used on the face and nowhere else. Okay, so if you have any questions, you might want to leave some comments below or email me, whatever is more convenient. Bye.